out of pocket of $5,100. So let's turn to page 48. You can, and what you have is your in-network and your out-of-network column with the benefits going down the side, okay? So now we're looking at the inpatient hospital. M Health is a tier 1, remember, and that's a $200 per stay for unlimited days at the hospital. If you go to one of the other in-network facilities for United Healthcare, it's $250 per stay for unlimited days. If you went out of network, for example, I'll use the Mayo as the example, and that copay is $250 per stay for unlimited days. So it's the same copay in or out of network. Then the outpatient, there's the ambulatory service, surgical center, the outpatient, and observation. The tier 1 is $150 copay, or tier 2, which is the non-M Health, or out of network, it's the same copay, $250 copay. So if you were to go to Mayo for observation, you would pay $250 copay, either the same as you would if you went to Alina. The primary doctor we talked about is a $0 copay in or out of network. The specialist is $25 copay in or out of network. However, the specialist at M Health is $15 copay. Virtual visits are $0 copay. Your preventative is a $0 copay in or out of network, and then there's a nice list. I mentioned a few things, but then there's a nice list of all the other things that are covered for preventative. So diabetes screening and monitoring, cardiovascular screening, lots of different things covered in addition to the one that I mentioned. Plus there's the routine physical that's a $0 copay. The emergency care worldwide is $90 copay. If you go into the emergency room, that would be waived if you were admitted into the hospital. And the urgent care is $40 copay, and that would be utilized internationally as well. If you went urgent care outside of the United States, you would pay a $0 copay. Go to page 50, in or out of network. So our diagnostic radiology services like CAT scans, MRIs, that would be $145 copay in or out of network. $0 copay for diagnostic mammogram. So if they find something when you're having a mammogram, you would pay $0 copay for that diagnostic. We talked about the lab services being a $0 copay. The diagnostic tests and procedures, $20 copay in or out of network. The therapeutic radiology, this is where you're going to see a difference. In network, it's a $60 copay. Out of network, it's a 40% coinsurance. So this is where if somebody went to see a specialist at Mayo, they might have their diagnostic radiology done closer to home at a different facility. And out of network, it's a 40% coinsurance.
I have a question backing up to diagnostic radiology. So MRI, CTs are $145 each.
Mm-hmm.
Is that correct?
Mm-hmm.
Okay.
Yeah. All right, then the x-rays, if you were to have an x-ray on your arm, if you broke your arm in multiple places and they did multiple x-rays, that would be a $15 copay. If you had 2 broken arms, it would be 15 times 2. Okay. The hearing, this is where you go in and out of network as well. You're going to notice some differences in copay in or out of network. So $0 copay in network, and United Healthcare owns their own hearing aid company. So you'll call United Healthcare hearing. They'll set up an audiologist appointment for you, And with that appointment, you can go in and you can pick out a hearing aid in ear or outer ear, and the range would be $175 to $1,225 copay. And the preventative dental, if you use an in-network dentist, you will pay the same copay in or out of network if you go in or out of network. But if you go out of network, they could bill a little bit more. So the service may cost $100, and United Healthcare would pay $75 to that dentist, and you would have to pick up the other $25. Okay? And you get $2,000 towards your dental. And crowns, caps, bridges, you pay 50% and United Healthcare pays 50% as an example. You know, if you need some denture work, that would also be covered 50-50. So you have a couple $1,000s to work with. The vision services, you can have your eye exams taken care of for a $0 copay in or out of network, and you can get up to $300 per year for your glasses or contacts. Mental health is similar to the hospital, inpatient hospital, and $200 copay or out of network or tier 2, $250 copay per year. And then your outpatient therapy, $0 copay, virtual health visits, also $0 copay. Now the skilled nursing, which is Part A of Medicare, this is where you see differences between in and out of network for United Healthcare, okay? So you can see in network, a $0 copay for days 1 through 20. Out of network, $150 copay for days 1 through 16. So this is an area where that copay could go towards that $5,100, okay? Because that's a Part A. Physical therapy, speech therapy, language therapy, $25 copay no matter where you go. Page 52, ambulance is again $250 ground or air. And the Part B, this is where you have your chemotherapy drugs or other types of Part B infusions. If you go in network, it's a 20% coinsurance. If you're out of network, it's a 40% coinsurance. And keep in mind that's the Medicare allowable amount. That's not necessarily a full retail amount. It's always the Medicare allowable amount, which is typically less than the full
But it
retail.
takes about 3 treatments and you reach $3,000 or $4,000.
Oh, easy.
Easily.
I had one customer reach it in 1 month.
Well,
Yeah,
mine
the first
I
month.
had 70,000 in a month,
Yeah,
so.
yeah, so you just reach it right
So
away.
there's
And
a huge difference between 20% and 40%.
yeah, the maximum out of pocket, 3,000 versus
Or
5,100.
Yeah.
That's your maximum out of pocket. And then after that, you would pay 0. Yeah, I hope you're feeling better.
Oh, yeah.
Good, I hope you're feeling good. All right, now if you go to page 53, here's prescription. So there is no deductible on any tiers. And you'll notice it says tiers 1 through 5 that we had talked about. And if you have a tier 1 and 2, if you were to use mail order, you would pay a $0 copay for your mail order prescriptions. And some people like to have that. If you don't use mail order on tier 2, you'll pay a little bit more money, $10 copay. The tier 3, like a shingles vaccination that you go into the drugstore to have, is $47 now times 2, because we have to have 2 shingles vaccinations. Then you'll also see the insulin here at $35 copay, which is really nice because United Healthcare participates in the insulin savings program. And what is it Humalog that, do you know, it's Humalog is the insulin that United has on their formulary. And you'll pay $35 through all the drug stages, but when you hit the catastrophic stage, then you'll pay, I think, 5% of that insulin amount. Okay? Page 55, the benefits just keep going. Oh my goodness, this is amazing. I'm so glad I'm a senior citizen now. Well, I never thought I'd say that. When I was working, my gosh, nobody would ever admit how old you were. I would never tell anybody how old I was when I was working. But then now they all know I'm a senior. It's pretty strange getting to be this age, I'll tell you.
How old are you?
I don't want to say, but you know, I could say, because now I'm amongst seniors all the time. So I just turned 69. Yeah, yeah.
Great.
Thank you. Yeah, but isn't that? I mean, I can't believe it, and we're just having so much fun developing this family business. I'm really having a good time with it. So page 55. See, I just would never say that when I was working. All right, acupuncture, $10 copay, 12 acupuncture visits per year. Chiropractic, $10 copay. The Medicare covered plus routine chiropractic, and you get 12 visits per year. Page 56, if you're diabetic and you have diabetic monitoring supplies, if you use these brands, you'll pay a $0 copay. If you don't use those brands, you'll pay a 50% coinsurance. And also the durable medical equipment that we